Hello. If you're viewing this video, you or a family member has been scheduled for surgery. I would like to provide some information for you so that you will better be prepared by knowing what to expect. After your physician has scheduled your surgery, you'll be given an appointment for preoperative testing and teaching. This will be either a face appointment where you will present to a designated area to talk to a nurse, or you will be scheduled a phone interview where the nurse will call you at home. The information that is needed at this appointment will be your health history and a list of all your medications, including supplements that you are taking. Please be as thorough as possible with this information, because this information is used in planning your care, including your anesthesia care. The type of anesthesia that your surgeon has requested will also be discussed with you at this appointment. If your surgeon has ordered any diagnostic work, such as labs, chest x-ray, or EKGs, it can be done at this time. If you have a phone interview, these can be done when you show up for the day of surgery. We ask you not to eat or drink anything after midnight the day before your surgery. According to the time of your surgery and your surgeon's recommendation, you may be allowed to have clear liquids up to 4 hours prior to your scheduled surgery time. These liquids must be stopped 4 hours prior to your scheduled surgery time. And please remember that clear liquids do not include citrus juices such as orange juice or dairy products such as milk, puddings, or ice cream. The clear liquids that you can be allowed are water, clear sodas, black coffee, tea, or Jell-O. As for your medications and supplements, you will be told which medications or supplements you need to discontinue, which medications you need to continue, and which ones you should take the day of your surgery. Please take time to make a list of these or ask the nurse to write these down for you. It is very important that you do not take any diabetes medications the day of your surgery unless you are specifically instructed to do so. Please remember, it is important that you do take blood pressure medications and heart medications. And if you're currently taking a pain medication and you feel like you need the pain medication to control your pain, you may take the pain medication the day of your surgery with a sip of water. It's very important that you follow these instructions regarding eating or drinking prior to your surgical procedure. If the stomach is not empty, then stomach contents can be aspirated into the lung and you could develop aspiration pneumonia. If you have not followed the instructions concerning eating or drinking, your surgery can be delayed or even canceled for your safety. As far as a skin prep prior to your surgery, you may be asked to shower the night before and the morning of your surgery using a special soap-filled scrub or using an antibacterial soap. This is one of the measures we employ to prevent infection. We ask that you not use a razor on or near your operative site, because if you happen to have a nick or a cut on your skin, it could be an avenue for bacteria or infection. If your surgeon has ordered a prep, then your prep will be done in the preoperative area with clippers that do not cut the skin. We also ask that you remove all jewelry prior to your surgery, and that includes rings and any and all body piercings. It's also important that rings be removed because you could have swelling of the hand or finger that could occur during surgery, and it could compromise your circulation. We ask that you leave all your medications at home unless you've been asked specifically to bring them to the hospital. If you use an inhaler or a CPAP machine, we would ask you to bring those with you. If you've also been given a brace, collar, crutches, or medical equipment that you're going to need after your surgery, then please bring those to the hospital also. Another important reminder, if you become sick with a cold, cough, chest congestion, have a fever, burning or pain with urination, a tooth abscess, sores or open areas near your operative site, please contact your surgeon as soon as possible. These conditions could be treated prior to your surgery and not cause delays. However, if you show up on the day of surgery with these symptoms present, then your surgery could be delayed or even canceled. Now that we've talked about the pre-op preparation, I'd like to talk about what you expect when you come in the day of your surgery. You'll be asked to arrive at least 2 hours prior to your scheduled surgery time. Some surgeons request that you get to the hospital 3 to 4 hours prior to your surgery time. When you present to the registration desk, they will ask for a picture ID and verify the information they have on file for you. A bracelet will be placed on your wrist. Please check this bracelet to make sure your name is spelled correctly and that your birth date is correct. These are 2 of the identifiers we will be using to make sure we have the correct patient having the correct procedure. You will then be directed to a preoperative area. If you need assistance getting there, we will make sure you have a wheelchair or whatever equipment we need to get you to the area. Once you arrive on the unit, we will be checking your weight. This is very important as some of the anesthetic medications are based on your weight, so we need an accurate weight. You'll then be directed into your pre-op room where you will be asked to change clothes and put on a hospital gown. Your nurse will again verify your name, your birth date, and the procedure you're having done. If your consent has not been signed previously, then this is a time where your consent and your anesthesia consent will be obtained. The nurse will then check your vital signs, blood pressure, temperature, pulse, and also your oxygen saturation. If you're diabetic, we will also do a blood sugar at that time. You also get a brief assessment from the nurse. You will listen to your heart and lungs, check for any edema, and ask if there's been any changes in your physical condition, and also assess your pain level at that time. During the time you're in the pre-op area, you also talk with your anesthesiologist, who will answer any questions you may have concerning your anesthesia, and you'll see your OR nurse and also your nurse anesthetist. Now, your surgeon will come in and speak with you prior to you receiving any anesthesia and make sure there's been no changes in your health history and that everything is in place and the understanding of the procedure that he is about to perform. Your family member will be asked to keep your personal belongings. If you don't have a family member with you, security will secure them and bring them to you after your surgery. When you go to the OR, your family member will be asked to go back to the waiting area to wait. The physician will talk with them after the surgery to let them know how everything went. The recovery room nurse will also call your family member and tell them when you're in recovery room and what room you have been assigned, or if you're going to the discharge unit, when you will be there. Another thing to keep in mind that your surgery has been scheduled at a particular time. However, your surgeon usually has more than one case scheduled, or he's following another surgeon in his designated room. Please remember, if the surgery before yours takes longer than anticipated or your surgeon is called to an emergency, there could be a delay in your surgery. Each patient will be given the ample time it is needed in order to best care for them. So please remember this, that the same consideration will be given to you or your family member. Your nurse will try to keep you informed of any delay, but please feel free to ask if you feel you are experiencing a delay. I hope this video will help you to feel better prepared for your surgery by knowing what to expect. Thank you for your time in viewing this video, and if you have any questions regarding your procedure,